Hello, good evening. Namaste. This is Ira Sahai back again with another D-Life Diploma course review video. I am a D-Life certified metabolic health consultant, also the Chief Operating Officer of D-Life Healthcare Private Limited. I have a very special guest and teammate and, D-Life family member with me, who is the first from Nigeria to complete the course. So this is the first course review recording from Nigeria. So I have with me Akerele Samuel Ayodeji, who is a Nigerian and is a registered nurse with about 4 years of experience and is also a farmer. His qualification is BNSC, currently studying for a master's program in advanced medical surgical nursing. And he enjoys politics, history, traveling, and football. And right now, also, he's traveling. He's back from some marketplace and he'll stop by
Okay.
to record this review. Welcome, Akireli. How are you?
I'm fine. Thank you, Ira. I'm fine. Thank you for the brief introduction.
Yeah, so good to see you on camera. And for the first time, we always interact with each other and through tweets and in the WhatsApp community, but we never had a chance to see each other. So good to see you.
Yeah, it's good to see you as well.
Yeah. So, actually, as I was just saying before we started the recording, I will come to the course. Shocking data there from Nigeria. I tried to do a bit of my research. Akerele can correct me, but non-communicable diseases is on a rise in Nigeria. Hypertension shockingly affects 30 to 35% of adults and often goes undiagnosed. There's diabetes, which is rapidly rising. Stroke and heart disease now among top killers. Cancers are increasing, which is very shocking because I was expecting probably some different numbers, especially for Nigeria, where people are living more close to nature and probably are not untouched by ultra processed foods and all of that. But the numbers are a bit shocking. There are 25% of Nigerians also are like, suffering from some form of mental disease. Fewer than 250 psychiatrists serve a population of over 200 million. So mental disease is also on a rise. And a very shocking data, I think it's rampant now. Doctor patient ratio in Nigeria is about 1 is to 5,000 to 10,000 people. So, Akireli, shocking data there from Nigeria. Please tell us a bit about the work that you're doing in the nursing segment and what kind of patients and what kind of people do you see every day?
The issue with Nigeria is that first of all, the statistics, Nigeria is a country that is still developing, and then we don't have an exclusive database, but from everyday experience working in the hospital, I work in intensive care units. In a tertiary institution. We have a lot of these diseases that you just called, people coming in with complications in critical conditions, people that having high blood pressure, diabetes, strokes, we get strokes, type 2 DM, that has progressed to a very bad state. We get that all the time in the ICU. And about being short-staffed as well, we have a lots of people, medical professionals, doctors and nurses migrating, out of the country for better opportunities as well. So that's why you see the significant patient to doctor ratio is really bad. And yeah, you would expect that people should be more healthy, living close to nature, like you said. But unfortunately, if you come to this part of the world, you find many of these things that are causing um, metabolic syndromes, the seed oils, people being chronically stressed, people having easy access to the refined carbohydrates. Everywhere you turn, you find them, in stock shops and the rest. So, before now, it wasn't like this, but we could see the rise, this whole thing that is being packaged as civilization or progress or development because we can access these industrialized goods, having a big detrimental effect on our health, even in the developing countries as well. So yeah, that's it.
Yeah, you're working in critical care and in the ICU, and I'm sure you're seeing a spectrum. And I think you're you know more about what kind of people are coming to you. So this seems quite dire. Akerele, please tell me, when did you decide to get certified in nutrition, and why did you come to choose to come to D Life? I remember the conversation that we had on X, and you had gotten in touch with me, and that's how we connected. And then Anup connected with you, and you immediately enrolled. But the thought of getting certified, because somewhere down the line, you do understand that metabolic syndromes are connected to, the dietary habits of a population. And where did that, stem from? What was the thought behind that? What was the urgency or the need to study low carb nutrition, and why D Life?
Um, the decision to study nutrition was due to the fact that I've been seeing a lot of informations online, from Instagram, Twitter, so many people coming up with this holistic care information, saying things about seed oils, refined carbohydrates, and I was intrigued. I was trying to find out if these things were true because I never learned about these things in medical school, and I'm supposed to. So I started, trying all these things by myself. Whenever I eat bread, for example, I observe how I feel, and I feel, terrible, abdominal upset, and all of those symptoms. And then I decided that I want to know more about this. And another thing why I picked interest in nutrition is because of the fact that as a nurse, we are not licensed to prescribe medications. So one of the ways that I can help my patients to live a better life is through things like dietary modifications and lifestyle, as well, which is part of the things that you get to learn on D Life. So I think for me, those were the reasons. And the decision to join D Life was from X, the X app. I think it was Aaron. Aaron, I think I'm not sure if I got the pronunciation right.
Yes,
He
it's right.
always, yes, yeah, he puts out tweets that are very intriguing, and then will make you go on Google and try to make research if what he's saying is right and all of that. So I finally made the decision, because whenever he posts, he puts the D Life at the end of his post on X and everything. So I finally made the decision. I've been considering it for a while, because it's quite a lot of money, but I finally decided that, okay, I need to do this because I was raised to understand that any money you spent on, developing yourself is not a money that has gone to waste. So I made the decision, and that was why I reached out. And yeah, that was it.
Yeah, so I'm sure you must have looked around for a few other courses, and just for the benefit of those who are watching it from overseas, from across India, there are only two courses in the world. One of them on low carb nutrition and metabolic health. One of them is D Life, and D Life has the highest CPD points accrued to the course, which is 144, biggest in the world. The second course to us is about 60 CPD hours, and as far as the fee is concerned, I think they are about, twice or maybe more price than us in INR, Indian rupees. So it is bang for the money, and the course is very exhaustive. As I said, CPD has given us 144 hours credit. So the number one course in the world as well. Also, tell me, Akerele, you are now part of the D Life family, D Life team. How do you find the knowledge that is shared? The forum, information that is there. People are posting blood work and mentors are guiding. How do you find all of that information and community support in D Life? So sorry for the technical glitch there. Akerele was getting a call and he got disconnected, but now he's back. So please tell us, Akerele, now that you've done the course, what are the changes that you've experienced in yourself? And have you tried to, help out your patients, your family members? What kind of transformation? Because you already know the science-based, the efficacy or the outcomes that low carb achieves, and Life's protocol or Anup's protocol of 100-gram carbs per day. But in your experience, after having enrolled in the course, what kind of changes, transformations, improvements are you seeing in yourself and other people around you?
Um, before I took the course on D Life, I had already started making changes because of the tweets that I was reading online. So I was already, reducing the amount of carbohydrates that I was taking, especially the refined carbohydrates. Refined carbohydrates, I know, no. I stopped taking the sodas, biscuits, and those sort of things. So when I took the course, when I started with the course, um, I started learning more things, the precise amount of carbohydrates, because before then I didn't know, it's on the course I started knowing the percentage of carbohydrate that I'm like, supposed to be part of my entire meal and everything. So for me, it has been amazing. Because I took this course for myself, I took this course because my health is my number one priority. So because of the fact that I'm a nurse, I cannot have this knowledge and not help my patients with it. But the reason why I took this course was for my own personal health. And for me, it's been amazing. Um, I'm not sure you could see my physique, but I'm very fit and lean as well. And I've been doing this for about 7, 8 months now. The results are amazing. I feel good. Sometimes I go for a day without feeling hungry, because I think at this point I'm fat adapted already, and no, no. Sometimes when I'm having headache, I just feel that I'm dehydrated. When I drink some water with, some salt in it, I feel good. I mean, it's been amazing. The level of focus is amazing. I think um, for everybody, even people that are not sick, this should be the standard, for their meal approach. This should be the way everyone should eat. It's quite challenging for me at first anyway. It wasn't easy. The cravings and everything. You just want to have some of those things that you used to eat and everything. But the more you do it, the easier it becomes. And for people around me, like you asked, my mom is 60 years, and she's a very active person, and but she still use the seed oil. The seed oils are quite cheap, but
Yeah.
when you try to get the coconut oil, they are more expensive, at least in Nigeria where I live. And nobody uses beef tallow over here. Nobody uses butter. Nobody uses all of those things. It's not something that is common. So I'm trying to get her to use, to ditch the seed oils and start using, coconut oil. In fact, I was the one buying for her, because I know that subsequently she will start buying for herself when she see the effect. So I'm trying to get her to I make some adjustment and nutritional modifications as well. And then for my patients and my siblings, most of my siblings, I'm trying to get them to do these things. A lot of them are making efforts. My sister, for example, she stopped drinking soda. She's but they still think fruits are a lifesaver. So many people over here, they eat fruits a lot. They think fruits, are good for you can eat as much as you can and everything. So I'm trying to reorientate them about this with this information that I've learned on D Life. And then for my patients, majority of the patients, for the patient people that I know personally that comes to me, I try to, give them this information and try to get feedback from them about how they feel. Some of them are my friends, and it's been working for some of them. Most of them cannot, they can't comply with this nutritional advice and lifestyle advice, but the people that could, comply with it, they've seen good results. And then for my patients, you find out in the hospitals, patients that are diabetic, for example, they still get PAP, and PAP is high in carbohydrates. And it's a normal thing that shouldn't be happening. Those kind of food shouldn't be given to a diabetic patient as well. But in hospitals, there are lots of diplomacy and hierarchy. You can't just, decide to influence what your patient eat and everything. So where I work, there is not so much that I do for the patient in ICU. But whenever I come across patients in the outpatient department, for example, people that just come in and then they see the doctor and leave, so I could just give them some advice and engage them about these things. And so many of them would say they will, give it a try. So as much as I can, I'm trying to, um, be well structured, in a way. Now that I'm certified, I'm trying to see if I could, have my own clients for myself and people that I could deal with directly without going through the hospital. I think that would be much better.
Yeah, and I would just kind of extend that point, of whatever you said. Clearly, one is that you are now officially certified through the biggest course in the world, which is CPD accredited. So probably I know that it is not so easy while you're working with a hospital, to surpass the hierarchy and start giving dietary advice. But we have 60 doctors now in the D Life community, and all of them, I think, down the road, and many of them already have are planning to give this advice for the benefit of their patients, because these are good doctors who are interested in remission. So a lot of doctors have opened their metabolic clinic as well. So there they are combining, when people come to them, for advice on pills and with metabolic syndromes, what they do is they start giving the knowledge that they have learned in the form of a formal diet protocol along, with their medical advice. And it has been seen by all the doctors almost that they have started to reduce the pills and improve their metabolic conditions. So you are certified right now. Maybe you can take your the permission of ethics committee in your hospital, and then, because I'm sure at the end of the day, since you put in so much effort and sincerity into doing the course, and it's the biggest course, and people should benefit from that. So glad to hear that, you are bringing a change about in your own family and your siblings and mom. And I think, Akrali, you should send me a picture of yours. I want to see how you look, and we will post it on Twitter, because that will inspire a lot of people, before, after pictures
Okay.
if possible. So I think you should go out and practice and spread the light and the knowledge that you have, got from D Life, Akerele. Coming to the
Thank
community,
you.
definitely you're part of the D Life family. You'll always be part of the D Life family. You have access to the forum, which is 10 years of curated low carb data, and which has been reviewed and gloriously talked about by the low carb stalwarts in the world, doctors. So all of that you have the WhatsApp community access, you have the forum access, and you can always interact with mentors. How do you like the support? Because no other course in the world has 10 plus years of curated LCHF data, low carb data, and therefore they cannot give. And even if they had, I'm sure nobody would have given it out just like that. So
Yeah.
not only have you completed the course and gotten certified, but you're still part of the D Life family. So how do you like this spirit of the family? And we have lots of fun in the WhatsApp community and everywhere. So
Yeah.
talk about that.
Well, for the D Life community, it's been amazing. That's all I can say. When I joined, when I subscribed, for the first month, Mr. Arnop reached out. Quite a few members of the D Life community reached out, and they were like, if I need any support, if I need any help, if I'm stuck or something, I could always reach out to them, and they would be excited to help me out with anything I'm struggling with. So, I mean, I was able to figure out most of the things, as a young person. You'd expect that I'm tech savvy. I could find my way around the website and community and all, but there are a few times where I about the
Yeah.
community and everything, and how Mr. Arnop would, be excited to help with navigating any difficulties that I was having during the program. And the the WhatsApp community as well. People would interact about the issues that they are dealing with their clients and everything. I'm more of a calm person, maybe because I don't have a client, So most of the times I just go on and read the interaction, and it's amazing. I learn a lot of things from the community as well, how people are, managing the clients and the lab values, the things that they are struggling with, how they would share. And then you have, top doctors and a lot of medical professionals that are giving ideas on how to handle, these things. So the community is amazing. I think that is my feedback on that. And I think it was I only reached out to Mr. Hanop, that I was having whenever I have an issue. I think it was just once or twice or three times, and he would, gladly help almost immediately. So that was commendable as well.
So I think now you should start practicing Akerele. You said you are not, you've just finished the course and you will, I'm sure you will start practicing down the line. Please tell us about the CPD certification and how many CPD hours do you require there to practice usually as a registered dietitian or a registered nutritionist? How is it? How does it work in your country?
For you to practice as a dietitian, you have to go to the university, to study, I think, nutrition and dietetics. I think it's a 4 years course. So, and when you graduate, you're certified, you have a certificate to practice as a dietitian. We've got a few dietitians in the hospital where I work. They are the ones in charge, they prescribe the meal for patients that have that metabolic diseases like type 2 diabetes, hypertension, and the rest of these metabolic issues. So for you to become one, for this, it was just a 6 month brief program, but I'm not sure there's something like that in Nigeria, or maybe there is, and I'm not aware of it. But what I know is that you have to go to the university and study for 4 years, in the human and nutrition department or faculty to be certified as a dietitian. So that is how it works over here. But a lot of dietitian, when they go to school, they graduate after 4 years, and all they do is, the mainstream dietetic advice, the ones where you optimize the carbohydrates, you tell people to eat low cholesterol, for certified saturated fat and all of these things, how it could damage the kidney and cause heart disease. That's the same thing you get over here, just the way it is in the West and American and all of these countries. It's the same over here. What you're doing is something that is new. I think what D Life is doing is new. Is something that is revolutionary in nature. They're trying to displace something that is in place already, and it's quite commendable as well.
Yeah, and just to carry that point forward, for example, we have many people enrolled from Australia. And in Australia, New Zealand, to practice as a registered dietitian there in those countries, they need about 30 CPD hours. So one of our enrollees who's in Australia, Prajakta, she went to her local, country association and registered, wanted to practice as a registered dietitian. And they told her that, you need to get 30 CPD hours. And she gladly told them that, well, I have the life certification and there's much more hours, in that certification than you would need. So at that time, we had about 60 CPD hours. Right now, we have 144 CPD hours. So immediately she could, register herself and start practicing without doing any other course. So as I was saying, Akerele, we have 21 countries now enrolled with us, and the reason why I asked this question was because one of our enrollees, certified consultants from Australia, she wanted to practice as a registered dietitian, and she went to her local country association, and they told her to get 30 CPD hours, which was the requirement there in that country to start practicing as a certified a registered dietitian. And she told them, that I am certified through D Life and I have much more hours than what is required by, my association. So she immediately produced a D Life certification and that CPD certification. Only 30 hours were needed. So at that time, when she registered as a dietitian there, we had about 60 CPD hours. And then the course went a massive update last December, and now we have 144 CPD hours. So CPD is recognized in 50 plus countries. The reason why I asked you this question was, what is the certification that your local association needs? Because if they are taking into account CPD hours, you have more number of hours to start practicing as a certified or a registered dietitian in your country than they will need, because Australia and New Zealand need just 30 CPD hours and we have 144. So coming to the next question, Akerele, tell us, why should, people, those who are located outside India, people who are located in your country, people who are associated in the profession with the profession of nursing, medical care, healthcare professionals, should they do this course? You've already talked about the fact that everybody should do this course, but why particularly these people who are working in the healthcare industry?
Well, I think the reason, can you hear me? Am I loud and clear?
Yes, yes, I can hear you.
Okay, okay. So I think the reason why every medical professional out there should take this course or a similar course like this is because many of the things that we've been taught in school are things that as much as there are a lot of good informations, there are a lot of things that are not really good for the patient as well. Because the reason why we all went to school to study as medical professionals is to be able to help sick people, not just sick people. We also want to be able to help people live the best way they can. Because I mean, there are lots of people now speaking about preventive care, so you don't even have to worry about, dealing with adverse medical conditions. So, but what we're being taught in school, the mainstream hysteria about saturated fat and everything is what is the common knowledge out there among medical professionals. For us in Nigeria and many African countries, many of us, I think due to bad leadership and incompetent people in the Ministry of Health, we've not been able to map out our own, compass and the way we would like to do things. Many of the things we do, we still copy, countries in the West, the UK, America. So you still have many of those influence in Nigeria as well. You have many of those multinational companies and corporations, coming to dump many of these products that are detrimental to our health. So for medical professionals, I think it is important for them to take this course because they need to unlearn, they need to unlearn these things, this information that we've gotten in school. And not just taking this course, we need to take a step further to make sure that we incorporate it in our curriculum as well. This kind of knowledge should be what everybody is learning in school, the medical doctors, and especially nutrition, because nutrition is important. It's a routine. People eat every day, and anything that is a routine would have a huge influence on your life. I mean, if you dance every day, the dance is going to have a huge influence on your life because everybody eats every day. So it's definitely going to have a huge influence on our health. It's a known fact that there is a strong correlation between what we eat, and how we feel and our health. So I think that is why it's important for medical professionals to take this course. And the good thing about this course is that everything that is being said is being backed up by scientific research. You have a segment for materials on those modules where you could access studies that have been carried out, and then you could see for yourself. And in fact, the origin of this hysteria about saturated fat, I never knew all these things. This and the Ansel Keys theories and everything, where all these things started, the theological connection and everything. I mean, if all medical professionals take a course like this, they would be able to link the dots and understand, the interests that are involved. They will understand the reason why, many of the things that we are being taught in school are that way. They will understand that it's not really because they want us to stay healthy. It's because of a lot of people trying to protect their interests, for different reasons, for profit, for power, and the rest. So it's a lot of information. And I think any medical professional that wants to be able to help their patients, in the best way they can, should take this course. I mean, we have the mainstream knowledge already, so it's worthwhile that we take this as well, so you can compare for yourself, and I mean, take out the ones that needs to be taken out, and you retain the ones that needs to be retained. But that's it for me.
Yeah, Akerele, if you want to give out your contact details for anybody who wants to get in touch with you and engage your professional services from India, from overseas, from Nigeria, any part of the world, would you want to give out your social media handle or anything else?
Yeah, of course I would. I think I'll be more comfortable with my social media handle. So on X, it is Sammy Alfred 7. That's my username. Sammy is Sammy with double M, Sammy, then Alfred with 7. So then on Instagram, it is Akerele underscore Ayodeji 1. So those are I'm more active on X and Instagram. I don't do much of Facebook, so you
Yeah.
could follow me on
So
those
I,
two social media handles.
yeah.
And
So I think
yeah,
a lot of people can get help and engage Akerele professionally, because not only is he a nurse, he has vast experience in the healthcare industry, and now he's also DLife certified in reversing chronic metabolic syndromes through low carb dietary intervention. So that's an added advantage. Akerele is based
and
in
I'm also a
Nigeria.
farmer.
He's also a
Being a
farmer.
farmer,
So
you're able to grow, you're able to grow these things by yourself. You tend to avoid many of those products that have been in stock for a long time. You get to eat fresh, products from the farm as well. That was my motivation for becoming a farmer.
yeah, I wish I could order something from you, here in India, but I think it'll take a lot of time and resources, to send something
Yeah,
here. But look forward to you
yeah,
coming to India
yeah.
anytime, any time recently, or soon enough, so we can catch up and spend some time together with D Life members. We
I'd
keep
love that.
having these
Yeah.
meets across cities in India, and huge D Life teams, and you're the first one from Nigeria to get certified. But before we close the session, just a brief about the course. Now, Akerele has CPD certification, which is recognized in 50 plus countries. D-Life is the biggest CPD accrued course of 144 hours that no other course in the world has. So, people who want to accrue CPD hours, they can also do this course, which is D-Life, Lowcarb Nutrition and Metabolic Health. In terms of the content, we are the largest course in the world with about 1,000 plus references in the course, and in our papers and researches, in the chapters. There are 250,000 plus words, 100 plus relevant videos. There is lifetime access to the course and 6 months additional access to the forum from the start of internship, but usually everybody has access for lifetime. We are India's only CPDSO UK accredited course. We are India's only the SMHP approved CMHE provider. We have the biggest CPD hours, as I said. Forum access is given free with the course access, and it's the world's biggest LCHF data with 2,000 plus recipes, 250 plus documented success stories, and thousands and thousands of success stories being created by our now 170 plus certified consultants from around the world. So, Akerele, I really think that either you take the permission of the ethics committee in your hospital and start educating people on your diet protocol. I do think that you should have a formal diet protocol, which should be available for people for a fee that you can decide. Because at some point of time, you do need you do need people to be serious about it, and there is no other way than to pay a fee. When people pay a fee, they do get serious about it. And Nigeria's metabolic health condition is now getting into a serious crisis with 1 is to 5,000 to 10,000 doctors ratio, doctor patient ratio. And as Akerele said, most of them have migrated out of Nigeria. So people like Akerele are the only hope, or I should say the biggest hope and the best bet for Nigeria at this moment. Akerele, by all means, I think you should go out and practice. You will have a huge practice there. You can even open your clinic or take ethics committee permission from your hospital, because if you show them the results of what this course can achieve for you, or the learnings that you have, or the certification that you have can achieve for you in terms of metabolic health, I think your hospital, your government, your community will be very interested for you to practice there. So I think you can do one of these and start your own clinic as well. I think you need to really go out there and work with people and also earn big, because sadly enough, but it is a growing market, and sickness, as medical protocol, they see it, has no reversal. And Akerele has been in the healthcare industry. He's been working in that sector. He's a healthcare professional for 4 years and above experience. And there has been no reversal. As he said, he has not been taught about it. So the things that he has learned from DLife, from the certification, will remain priceless for his own community. Any last words there, Akerele?
I just let me use this opportunity to appreciate, members of the D Life. You guys are amazing. Um, you're not the first, Indians that I've had contact with. Where I work here, I have about three Indians, one of them usually help with the payments because I was struggling to make payments at some points, so I would send money to him in Nigerian currency, then he does the payments. They're amazing people. So and then I met you guys from India as well, and you guys are amazing. And I really do hope that we continue to, keep this relationship. We could always, stay in touch and everything. There's so much that we could achieve as long as metabolic health and nutrition is concerned. So I just really want to thank you guys. And I would always reach out, because if I'm to have my own clinic and help people, there'll be times that I'll need help, so I'll always stay in touch and everything. So thank you very much. And God bless you.
Yeah, Akreli, I think you will be very result oriented once you start practicing. And if you're planning to have your own clinic, I think you will have a much bigger and much roaring practice than even doctors, because everybody needs help. And this is the simplest thing that you can do, probably make the simplest of dietary changes as per your cultural preferences and, habits that people have there. The local food habits, the local food items. You're also a farmer. So I really do think that you should step out there and make a practice of your own. What is, by the way, the meat consumption, per kg, per person per year there?
The meat consumption. The good thing about the meat consumption here is most of our meats are, beef, are grass fed. We still have this. People still give beef, grass to feed on, unlike what you have in the West that they get grains and many of these things that they feed on. But a lot of people are misinformed as well. They believe that red meats would cause cancer, colon cancer, and this mainstream misinformation and everything. So, but the meat consumption is good generally overall. You could go to the markets, you see the meat vendors everywhere, they're selling meats and they come there every day. So it's easily accessible and everything. Meat is something that never, I always have at home, meat and eggs. If I don't have anything else, I would always have meat and eggs. So I think generally
How
the
many
meat
eggs do you
consumption
eat
is
in a
good.
day, Akirili? How many eggs do you eat in a day and how much meat?
An average of 5 eggs in a day, sometimes seven, sometimes eight, because I at least 3 times in a week I would, do cardio exercise and resistance training. And then for the meats, um, most of the times maybe 100 gram, sometimes 150, sometimes 200, depending on the amounts of training I put in for the day.
So probably before we end, if you want, you can step out and show us your, physique. You talked about your physique and how fit you are now compared to what you were earlier. So you can do that. No issues.
Okay, I will just show you my arm,
Ah,
so you could see.
oh, wow.
I'm still trying to build more muscles though.
Yeah.
Right now, before I started resistance training, I was weighing 74 kg, but now I'm weighing 82 in 5 months. So that's a good progress. But my target is, let's say, between 87 to 90 or maybe 95. So you can't because I'm actually in the town. If I was at home, I would have shown you, a better view. But I'm in town. I just have to park somewhere, so I can't step outside and show you a better
And
picture.
how tall are you, Akrele?
I'm 6 feet.
6 feet. So this is
Yeah.
a D Life member, our teammate, family mate, family member, who is also there with us on the WhatsApp community, and we have a lot of fun. This is Akerele, and this is how, this is the spirit of the life, as Akerele just said, and showed his biceps. So I think that's very inspirational, Akerele. Maybe you can send us a before and after picture also. So we will tweet with your picture
Okay.
the difference that the course
Okay.
has made in your life. Yes.
Yeah, I will.
Thank you so much, Akrele, for taking time out to record this session, and a very, very valued team member. And all the best to you for your future practice as you start. We are all there for you. Any help that you need on the community with your cases, with the blood work, with the diet protocol, we're always there for you.
Thank you. Thank you.
Thank you. This is Ira Sahai signing off. I'll be back again with another D-Life Diploma course review video. Till then, take care. Bye-bye. Namaste from India, Akrele.
Bye, Hira. Bye. Thank you.
Namaste.